MRI of my hip because all I would do is limp all the time. And the doctor that I went to told me that I needed a hip yesterday, that I had bone on bone. So I called up Dr. Magaziner and I says, could you help me out? And he says that there's this procedure that he could try. He has to see my MRI first. And if it looks good, he could probably get me 5 to 10 years before I would need a new hip. So I says I was willing to try and go see what it was like. I'm able to exercise again. I go on the treadmill. I do an elliptical cycle. I own a laundromat, and I have to jump over washing machines to get to the drains and stuff, and before I wasn't able to do that, and I'm able to do that pain-free now.
I had tendonitis in both elbows. In this one, it was on the outside, and on the right one, it was on the inside, and the pain was very severe. So I had tried everything else, and my last alternative was surgery, which I really didn't look forward to. And then I heard from a friend here in the library about Dr. Magaziner's treatment. After about 5 or 6 treatments, both elbows started feeling much better.
So what would you say your pain level was in the beginning?
My pain level, probably in one arm, in my left arm, was around 7 or 8, and in my right was like a 10.
And where did they drop to?
I feel tremendous. I can lift weights now, and I can lift my kids and play with my dog and do all the things that I used to do.
So how many treatments would the average person get, or is it case per case? What is the least number, or maybe the maximum?
The least number I would say is 4, and the maximum that we're doing in one series would be up to 7. And then after that, someone might come for maintenance once a year, for example. And if we're treating a bad arthritis of the knee or the hip, once we're able to get their pain level down to the range that they're happy with, then I might have them come back and just give a booster treatment once a year or something like that, depending on what they need.
I asked you 5 years ago what you saw in the future, so I'm going to ask you again. What do you see for the future now? Where will this go from here?
Well, we already have the growth factors, and now we're working on more concentrated ways to get stem cells. And once we have that, we'll be able to do better transplants of the stem cells, growth factors together. So I think that we're already there in the future. Whether we're going to talk about regenerating new joints in a test tube and transplanting, I can't say that. But I think that as this technology gets better, maybe we'll actually be able to see some reversal of arthritis and things like that going on. I mean, there's a company out there that I've been watching that makes cartilage grafts, and the orthopedic surgeon, for example, someday soon we'll be able to do an arthroscopic procedure and just put on a whole new layer of cartilage, in one procedure.
I'm waiting for that one.
It's going to happen.
It's going to happen.
So we're all part of a piece of the puzzle. Disc replacement. We're working on technology now where we'll be able to repopulate the disc with a new nucleus and repair the annulus. So people that have herniated discs and degenerated discs will be able to repair the inside of the disc. So
this has been the fastest half hour I've been through in a long time. Listen, I thank
Dolly,
you.
Thanks for inviting me down.
I thank you so much. I thank you for being you and caring and working with so many people. To all of you out there, this is kind of my retirement show. It's the last show of my series that I'm going to be doing. I won't be gone totally, but I will be gone every month. And so this has meant a lot to me to do this show. But this is a wonderful, wonderful little pamphlet, and they are available. It tells you all about PRP, and it's in very simple language, so anyone can understand it. And all you have to do is call the doctor's office, and he will send it out to you, and we'll scroll under his telephone number of his office. He is a wonderful guy and has done a lot for our family. So I thank him, and I thank all of you out there for watching all these years. Take care, and I'll see you soon.